Good morning, everyone, and thank you for joining us for our weekly briefing on Medicaid and SNAP. Just a couple of housekeeping rules. The briefing will be recorded, and we will have slides that will go out later on today just to orient you so you don't have to take notes. I'm going to ask that everyone please stay on mute. We wanted it to be like a family, so we have Hollywood Squares, but just a reminder for everyone to stay on mute. Thank you. Um, we're going to also reserve half of the briefing for questions and answers. So let's get started. Please drop your name, where you're from in the chat, your organization, and we look forward to the conversation today. So we have here with us today, again, Gordon Bonneman, our staff attorney for TJC, also Signe Anderson, who's the Senior Director of Nutrition Advocacy, and my name is Tanae Franklin, and I'm the Chief Strategy Officer. Let's go ahead and jump in. Gordon, I'm going to ask you to give us an orientation. Where are we? What has happened over the last week? After Gordon, then I'm going to come to you, Signe, to talk more about where we are with nutrition, and then Gordon is going to talk specifically about Medicaid. Gordon, I'm going to turn it over to you.
Thanks, Tanae, and thank you everyone for so faithfully hanging in with us over these series of briefings. I'm going to recap really quickly. I know that most of you have probably already been following this, but just to let you know that we're seeing the drama come down to the wire in the next couple of weeks, probably. Back when, immediately after the election in November, it was evident that there were going to be major threats to the safety net, and it wasn't long before those began to take shape. As probably most of you know, the Congress is using the budget reconciliation process, which is an arcane procedural device to avoid a filibuster in the Senate, which means that it can pass in the Senate by a simple majority. The Republicans have a slim majority in the Senate. They can't afford to lose more than 3 Republican defections. It passed the House in April, and it is now called the One Big Beautiful Bill. It basically is carrying President Trump's domestic policy agenda, not just domestic, because it also includes enormous increases in defense spending. But it includes many things. The main features are a combination of tax cuts, which disproportionately benefit people at the higher end of the income scale, and it balancing that out, but only partially, are a series of cuts to domestic spending, primarily, but not exclusively, to the social safety net, which is, of course, what concerns us here today, Medicaid and SNAP. The bill came out of the House. It's in the Senate. The latest estimates are that it could get to the Senate floor as early as June 18th. In other words, 2 weeks from now. The goal of the Speaker, the Majority Leader, Senator Thune, as is the goal of the House Speaker, Mike Johnson, and the President, is to have this done by July 4th recess. Again, we're coming down to the wire. What's happening this week, and there are literally hourly bulletins coming out of DC about all of this. First, the Congressional Budget Office just issued its final scoring of the House bill. Until now, we've had preliminary estimates. It confirms the big picture, which is basically a combination of $1 trillion in Medicaid cuts and over the next 10 years, and $300 billion in SNAP cuts over the next 10 years. That's $1.3 trillion total and federal funding, as I'll explain later, that understates the impact of Medicaid cuts because it doesn't include the effect on state spending, which will also be reduced. So that's the big picture. We have in previous briefings talked about numbers of people losing coverage, losing benefits. We'll talk about that some here today. Those were based on preliminary estimates. The final CBO estimates that just came out are not dramatically different. So we'll probably continue to use those until our national colleagues come down with updated data. But again, the big picture is the same. Unprecedented draconian cuts to the social safety net that will affect not only the people benefiting directly from enrollment in Medicaid and SNAP, but also the larger communities in the economy. And decisions are being made this week in Senate committees behind closed doors. They are expected to roll out their reports by this time next week. Significantly, the Agriculture Committee, which has jurisdiction over SNAP, was supposed to issue its report with its amendments to the House version. Today, that's been pushed to the end of the week because of troubles in that with Republicans agreeing on what the changes should be in the Ag Committee, primarily around the SNAP cuts and some pushback on that. So that's sort of the latest news from DC, again, sort of unfolding almost hourly. So thanks, Danae. I'll give it back to you.
Before I turn it over to Signe, could you just reiterate the timeline? I feel like the timeline is sort of a moving target. And so that is making sure that we have to stay on our toes. So just reiterate the timelines, particularly as we think about engaging our stakeholders and our networks for advocacy efforts.
Sure. Yeah, it is a moving target. And unfortunately, it's been sort of collapsing back so that the timeline is being compressed and things are happening more quickly than anticipated. The various Senate committees are coming up with the Senate amendments that they will recommend that the full Senate adopt to the House version. It's expected to go to the floor before the Senate 4th of July recess, which actually starts the week of June 24th. But more recently, the Majority Leader, John Thune, said the vote on the floor could occur as soon as 2 weeks from today. There are a lot of moving parts. We'll talk some more about that. But so that may be ambitious or aggressive, but I have to say, so far they've been meeting their targeted dates. So I think we don't have a lot of time. By this time next week, we should know what the Senate amendments are because the committees are to have all reported out by then. But of course, by that time, it will be less than a week before the potential floor vote. So our response needs to be occurring this week and next.
Thank you, Gordon. Signe, please let us know what's going on with SNAP and nutrition overall. What new information, if any? Well, I guess, what do you know that's sort of tried and true? And then do we have any new updates?
Yeah, I think just going off of what Gordon shared, but looking at SNAP, we were hopeful that the Senate bill might be a little different, and we're still waiting to see if that's true. But I think coming out of the gate with what we know right now, we're concerned that it might not be that different than the House version. The Trump administration has been really pushing for the Senate to take up what the House has proposed. So I think we should go into this kind of fearing the worst, and so we should be really reaching out to our senators to let them know that we don't want the House version. For the SNAP side of things, we're still anticipating the worst and largest cuts to SNAP that we've ever seen in the history of the program. We're anticipating 3.5 million people could lose SNAP benefits across the country. The major change that popped up in the House bill that it is likely to come through in the Senate bill as well is the state cost share. On the SNAP side, we could see a cost of up to $800 million that the state would now be responsible for, which is not a cost that the state has had to accrue in the past. So that's a major concern. If states have to take that on, will states be able to fund that? Likely no, and that's an area where we anticipate a lot of people being cut from the program. The other concern is the work requirement. The House has worked to change the work requirement, which would require more seniors to have to be looped into the work requirement piece to adhere to the work requirement. And then the other major concern is families. The House version requires families with children ages 7 and older to adhere to work requirements, which would be a major problem for SNAP families, and doesn't take into account the cost of childcare and all the other implications for families with children over the age of 7. And just the fact that raising a family is a job in and of itself that's unpaid. This is not being taken into account. And so all of that is still on the table for the Senate version, and we're still waiting to suss out the details there. But I would make sure that folks are talking to the House version, to their senators, and stressing that all of those provisions are terrible and should not be moved forward in the Senate version.
Thank you, Signe. That's a lot of information, but the takeaway message has been consistent over the last several months, is that these policies are going to hurt the most vulnerable in our communities. We do, for those that like numbers and data, we do have that available on the Join Us page on our website. And we're also going to send out a slide deck later on today that will also have that information at your fingertips. Just wanted to let everyone know that. And for newcomers that have come on, please make sure that you're on mute. And then now, Gordon, I'm going to turn it over to you. Give us an overview of what the newest information regarding the impact to Medicaid in Tennessee and across the country is.
Thanks, Tanae. The final CBO scoring, which again is just a couple of hours old, confirms that Medicaid will be cut over the next decade by $1 trillion with a T. And when you get the PowerPoint that we'll be sending around later today, we'll try to have some more updated numbers. But I think the $1 trillion is the number you can hold on to in federal funding cuts. You can't take $1 trillion out and still be in the position that the defenders of those cuts claim to be in, which is that this is only about fraud, waste, and abuse. Or that it won't affect the people who really need the care. It will inevitably have a terrible impact on kids, on people with disabilities, and on older adults. And again, you'll get some of the specific numbers on that. Just one thing I want to add, which is there's a lot of focus, and we've certainly focused, because this is about the federal budget, on the $1 trillion that will come out of Medicaid. But there's been a new analysis that came out yesterday. As folks may know, Medicaid is a joint state federal program, with the feds putting up most of the money, but not all of the money. And the way it works is the state has to put up its matching share, which in Tennessee is about a third of the cost of medical services, and then the feds add on to that. So the two funding streams are sort of yoked together. If you cut $1 trillion out of the federal funding, you're going to inevitably reduce the state funding that goes with that as well. So when this new analysis shows that the actual impact in terms of dollars coming out of the program will be more like $1.3 trillion coming out of Medicaid funding over the next decade, which will be catastrophic. So that's sort of the latest in terms of the big picture. The estimates based on the preliminary CBO data was that some 75,000 Tennesseans would lose coverage immediately, and that over time, the number of uninsured would increase by 250,000 Tennesseans. So there are other aspects of the bill that are very negative that we've talked about in the past, such as the fact that the bill does away with minimum staffing standards for nursing homes, vital to not just quality, but actually safety of people living in nursing homes. And that's true whether those individuals have TennCare or privately paying. That's one of those examples where the ripple impacts of this bill go far beyond the people who are directly enrolled in the programs. We will see a drop off in funding for rural healthcare infrastructure, which will endanger access to care for people living in rural communities, regardless of their insurance status. Just as we will see the impact on food deserts of pulling 300 billion or whatever it ends up being out of SNAP. That's money that's not flowing into low-income communities to their grocers. And you're going to see some grocery stores closing in impacted communities as a result. So that's what's going on right now.
Thank you. We have a few questions that are coming through and comments. What I like about the format of this briefing that we have today is that we're able to share information with each other. So it's not just coming from TJC to the audience, but it's also coming from you all. So Bruce Kiesling said, the mega bill has eliminated the national network of university centers for excellence in developmental disabilities established in 1963. And we have one at Vanderbilt and one at UT Health Sciences Center. So now we're really starting to understand the impact. My question to you all, either Gordon or Signe, when do we anticipate feeling the impact? So some of the models span over 10 years, some articles and information coming through say it's going to hit immediately. What can we expect regarding the timing of potential impact?
That's in flux, like everything else. It could be changed in the Senate, and I appreciate Bruce pointing that out. I mean, we're focused on Medicaid and SNAP, but there is so much in this bill that is so destructive that affects infrastructure and research that we just have taken for granted. In going back to the Medicaid, although it's in flux, the different features are generally designed to take effect. The features that focus on Democratic states, because there is, frankly, a very partisan effort to increase the impact on Democratic states by the Republican majority in the Congress. Some of those would take effect right away. The work requirements right now, as it came out of the House, would take effect just after the midterm elections, so people would not feel the impact when they go to the polls next year to vote for House members or senators. So they would postpone that until immediately after the election. It should be noted that those work requirements are extremely complicated to implement. And that's where most of the savings come from. With regard to the work requirements, it's not that it makes people ineligible because they're not working. It's because it makes them ineligible because the reporting is difficult, and the ability of the states to process the information, to track when people are working, et cetera, it is very difficult. It will require a lot of software updates and changes. And we know from experience here in Tennessee that over a 2-year period, less than that, 15 months last year and the year before, we lost 400,000 TennCare enrollees. And we know from the litigation that TJC has been involved in it, 3/4 of those were ineligible, not because they didn't meet the eligibility requirements, but because they couldn't navigate the paperwork. Work requirements create an enormous new tar pit for people to have to negotiate in order to keep their coverage, whether they're working or not, whether they're exempt or not. So we get questions, surely there are exemptions for people with disabilities. That's true, but that only means something if the state has the capacity to recognize someone as exempt. And we know from experience, not just our own experience with existing requirements in Tennessee, but where work requirements have been implemented in Medicaid in Arkansas and Georgia, it's been a complete train wreck in terms of eligible people losing their coverage because of paperwork snafus. So that's an example of something that would take effect right after the midterms. Some of these other things would take effect farther out. The idea that work requirements would that the states would be able to reliably change their systems to process all that in 18 months from now is just mind-boggling. And in fact, there are some senators that are simply warning that as a practical matter, you can't make that happen. So a lot of this will be phased in over time, but the effects, particularly of some of the financing changes, will be effective immediately.
So that being said, when it comes to the advocacy message and engaging with our senators, would it be better to talk about reporting requirements versus work requirement and not work requirements? Is there an advantage at all, either way?
Well, there's I heard one person, actually the head of Little Lobbyists, the parents of children with special health care needs, whose children have been lobbying against this, describing the work requirements as a job loss penalty. That if you lose your job for any number of reasons, including if the economy begins to wobble, as is expected, then in addition to suffering all that goes with losing your job, you lose your coverage as well, or you lose your SNAP benefits as well. So I think we just need to, we know from polling that if you just say work requirements, that's generally popular. When you explain all that goes into the way that actually gets rolled out, people say, oh yeah, I get it. So we just need to make clear that this is not, the CBO savings are not from people dropping off the program because they're working, but refuse to work. It's because of the attrition that will come from the paperwork.
Thanks. Signe, could you talk a little bit about how we should be understanding the money lost, the projected resources lost to agriculture in the state of Tennessee?
Yeah, well, real quick, just to end on what Gordon was talking about, I think the nuance is also really important, which Gordon mentioned, just with many of the families that we work with. If you're forcing them into a job that they are overqualified for, but pays them very, very minimal amount of money. I think it's really important to bring up the childcare costs. We don't do enough to address childcare costs. And so you can force a parent to take on a job that does not pay them enough to cover the cost to care for their child. So I think that's important to bring up. And also there are so many families that are working, and I think that's the other piece here that Gordon also flagged. As far as the cost, the cost nationwide, in 2020 there was a survey that showed that SNAP supported nearly 199,000 jobs within the independent grocery industry, and then also another 45,000 jobs across the country in related industry jobs, such as manufacturing and transport. So I think that's another thing to keep in mind. Just for stores in low-income neighborhoods and in some rural areas where there's high participation in SNAP, they can see up to 50% of their sales coming from SNAP participation. So that's other data that's coming out. And we have a lot of rural areas that have high SNAP participation that should be factored into that. So cuts that come through the reconciliation bill could really see a loss, an economic loss to those stores, and could even see some stores close if the impact is severe enough, which is likely to be severe given these cuts. So I think that's something to keep in mind for folks.
Okay, before we go back to agriculture, I'm staying on work requirements. I think this is probably a short answer, Gordon, but regarding the legality of work requirements, there's a question in the chat. Are they illegal or not?
They are illegal under current law, and Tennessee asked for a waiver back during the last Trump administration, and that never was acted on. So that's still hanging out there like a sword of Damocles over us. And this legislation could make that legal. So it would override the previous court results.
Ooh, this is complex. Okay, Signy, talk to us about agriculture and the impact to agriculture in the state.
Yeah, I mean, same with the grocers. The agriculture is very important to what goes into our grocery stores, and so we could see across the country a job loss of around 65,000 jobs, agriculture specific, given recent data that's out as of March 2025.
Okay, I'm keeping track of all the questions that are coming in. The next question I would like to lift up. Would it be so? I'm lost. Okay, still work requirements. Age at what seniors would have to be included. Signy, you had mentioned that seniors, older adults. So do we have I think I know the age, but I'm not sure. So I'm going to ask you because I know you probably know it off the top of your head.
Yeah, for SNAP, it could be up to 65.
Okay, all right, that's good. So are there any updates about the possible elimination of Medicare savings programs, which is funded by Medicaid? I know in my reading and when I listen to news bites, I don't hear a lot about Medicare savings, but do we know anything at all, or where should we, is anything going to change with the Senate amendments that would impact Medicare?
Well, we can't know what the Senate might do to it, but we know what the House did, which was, and just for background for folks who may not be familiar with it, Medicare savings programs are administered by the states, and they use state Medicaid dollars. In Tennessee, it would be TennCare to pay the premiums and cost sharing for low-income Medicare beneficiaries. Medicare, of course, being the separate program linked to Social Security that covers retirees and some disabled adults. It's very important in terms of making the Medicare benefit sufficient, because Medicare has cost sharing and premium requirements. And for low-income seniors, if they can't meet those, the coverage just simply isn't there. It doesn't work. So the Medicare savings programs have been paying that. And I haven't looked at the new CBO report, Congressional Budget Office report that just came out this morning. Haven't had a chance to look, and I don't know whether our colleagues have done an analysis yet. But on the preliminary report, and again, there aren't dramatic differences, it was expected that 1.1 million, I believe was the number, Medicare seniors would lose their MSP, their Medicare Savings Program coverage, and with that, see a severe degradation of their Medicare coverage, practically speaking. Again, because of paperwork, not because they're going in and saying we're doing away with this, but because they will make it more difficult for seniors to navigate that. That a lot of what is being accomplished in this legislation in terms of savings is done indirectly through paperwork, and Medicare savings programs are a casualty of that. I saw there was a New England Journal of Medicine article last week that projected the number of, and I think it was something on the order of 18,000 additional deaths annually among Medicare beneficiaries because of the inability to access prescription drugs as a result of their loss of subsidy for a separate Medicare program called low income, LIS, low income subsidies for prescription drug benefits. So from the beginning, the president and congressional leaders have said this won't affect Medicare beneficiaries, but in fact, we now have the data from CBO that it does, and it will in some very negative ways.
Gordon, talk to us about children's special services. How will this bill, the proposed cuts, impact children's special services?
Short answer, I don't know. But we will try to find out and get an answer if there is one. That, of course, is a block grant that is funded separately from Medicaid. It's small, but in the total scheme of things, but very important to the children who benefit from it. The program's been around since literally the 1920s under different names. That we would have to worry about that program now, it just shows how unprecedented these cuts are.
Yeah. So earlier in the chat, someone mentioned the loss of millions of dollars in research funds to Vanderbilt. This is also happening at Meharry and our academic institutions across the country. This is still important, even though we're focused on SNAP and Medicaid. The only reason we know about the potential impact and how harmful it will be is because of the research that has been done at the academic institutions. That being said, is there anything being done to keep healthcare navigators in place to help with the changes and keep people insured? And these are the individuals that are benefiting from the research, right? The health outcomes research, the medical research, cancer research, and so forth and so on. So what does that mean for healthcare navigators?
Well, there is, the Washington Post had an article yesterday with the revealing name, are Republicans trying again to repeal the Affordable Care Act, Obamacare? And the answer was, it's death by 1,000 cuts. Instead of the frontal assault that occurred 8 years ago where they said repeal Obamacare, now they're doing things like removing the funding for the Navigator program, which helps people access Affordable Care Act insurance and evaluate which plan to select. That's very important. Unrelated to the ACA, there's another program called SHIP, the State Health Insurance program, I think is what the acronym stands for, which in spite of the name, basically is a program that provides federal funding for counselors to help Medicare beneficiaries know what plans to enroll in and how to access their Medicare benefits. I mean, that to me is just gratuitous. I mean, why you would take that away from people is sort of beyond me. But that's an example of how Medicare beneficiaries who supposedly have an ironclad guarantee that they won't be affected will be affected. But
So,
that's basically another navigator program for Medicare beneficiaries.
right. Gordon, what is sequestration and how does it impact the rural and safety net hospitals?
So sequestration is the process where the executive branch says, okay, we know Congress appropriated this money, but we're, quote, sequestering or withholding this funding. And you've seen that with the DOGE, the so-called Department of Governmental Efficiency, led until recently by Elon Musk, coming in and saying, we're just cutting off these funds. We're notifying people you're no longer funded. There's a process that was held illegal some time ago. So I think that a lot of that has been characterized as temporary. And sequestration there's now a process for rescission. And just, I think yesterday, certainly this week sometime, the president has sent to Congress a package of cuts that would be blessed by Congress through the so-called rescission process, where even though the president cannot permanently take back this money, the Congress would say, that's okay, we bless this, and we rescind the funds ourselves. So I don't know what's in that rescission bill in terms of some of the cuts that have been made. The political pundits say that the Republican members of the House are likely to approve those rescissions, but I just don't know how that affects rural hospitals.
Let's switch gears for a moment to advocacy. You all have been with us on this call week after week. I know that there are some new faces and voices on the call as well. But this is, we're sort of holding our feet to the fire and making sure that we stay the course. Could we talk about, Signe, some of the advocacy efforts that you and your team have been involved in? And for those listening, I'm going to be asking you what's working for you, what do you need, what would be helpful as you engage your networks in this advocacy space. But Signe, tell us a little bit about what you're doing and what's working from your perspective.
Yeah, I would say number one, stories. Stories from people who participate in the SNAP program, who have had coverage and have had it denied. I think those stories heard, lifted up to the senators, to the representatives, help to get the point across about what the reality is of these cuts and how it would harm Tennessee. So I think that's number one, very important, and which has the ability to move legislators. So I think those direct stories are really important. I think intrepid, consistent calling, emailing is really important too. I think sometimes it feels like you're hitting a wall, but I think speaking out is really important. So even if you don't have a story yourself, if you serve people who are impacted, if you see things in your community, I think that's really important to lift up to the legislators. I think the numbers of people that were reaching out when this was moving through the House was really impactful. Even though it moved through, it got through by just one vote. So if we keep it up, I mean, we have the opportunity right now to influence the Senate vote, and so there's still time here, and I think all of us speaking out with stories, with your experience, with your feelings of how this will, your feelings and facts and data about how this will impact are really important. So those are some of the main ways. Also, and Gordon will share a little bit about this too. I think we press conference. We know some of our partners who I think are even on this call today joined in a press conference yesterday, and so having organizations that serve these individuals speak out to the press publicly also helps to make an impact. So I wanted to lift that up too.
Thank you. Yes, we did have the press conference yesterday and stories resonated. In fact, in order for us to make sure that we get media coverage from traditional media, that traditional media is still a thing, it's not just social media, we have to have stories. And at the press conference yesterday, we were able to lift up those stories. But we only get the stories if you all share them with us. And so if, let me say this, if you share a story and you're concerned that it's going to be used and you're not comfortable with it being shared publicly, you can note that when you leave your story with us. But what it does, it helps us be able to categorize the types of stories that we have so we can talk about the impact in an aggregate. And then for those that are comfortable, if you're willing, there might be interest from the media. So this is part of the advocacy strategy. Gordon, I'm going to ask you. So I know that our senators have been very consistent in support of the cuts. And some might question whether or not it's effective to continue to call our senators. So I'm going to ask you two things. One, help us understand why we should continue to call our senators, even though they seem unmovable in support of the president's big, beautiful bill. And two, how do we think about what other senators outside of Tennessee are on the cusp that could possibly be moved? And is there a role for us here in Tennessee in engaging in that space with those senators?
That's a great question. Thank you. I think that the role for folks in a state like Tennessee, where the senators are frankly unlikely to change their vote, is to do what our colleagues from other organizations worked with us to do yesterday. And kudos, shout out to the American Cancer Society, Cancer Action Network, American Heart Association, American Lung Association, the Tennessee Disability Coalition, the Tennessee Caregiver Coalition, Age Well of Middle Tennessee, the Chattanooga Area Food Bank. If I'm leaving anybody out, I apologize. It was a wonderful team effort. They were all great. Oh, Family Voices of Tennessee. Compelling stories, generated great coverage. And I think we want to be part of a loud voice that covers 50 states in the District of Columbia saying, don't do this. Whether that influences the vote of our senators, we still need to do that because the volume and the consistency with which that message goes nationwide will influence the president and it will influence senators in other states. We know that the Senate Majority Leader is right now in constant meetings. There were meetings this morning with the agriculture, the labor and education, the various committees that are tasked with coming up with the amendments. They are meeting with their members from all the states that have Republican senators to try to sort out their differences. And those differences are quite serious. If we end up winning this, who knows who we have to thank for it? It may be people on the extreme right that are fighting to make even more draconian cuts to the safety net. We could end up in their debt because if they end up making this too unpalatable, then the moderate, so-called moderate Republicans who are already uncomfortable with cuts to Medicaid and SNAP could bolt. So our job is to simply say, this is wrong for a whole host of reasons. We may have Elon Musk to thank for this. He just came out and condemned the bill as an abomination because it will add $2.4 trillion to the national deficit. So we can't know what will influence people even beyond the state, including the calculations of some of the key committee chairs and the leadership, that when they see coverage from Tennessee or they get stories from Tennessee, or when they ask Senator Blackburn or Senator Haggerty, what are you hearing from your members? We've got to put together something that can get 53 votes or get 50 votes plus the vice president to break a tie. And that can then, remember, whatever comes out of the Senate has to go back to the House. The president was urging the Senate to just adopt the House version, so that wouldn't happen. But the Senate has already made clear, no, it's going to write its own bill and it's going to make its own changes. So as Sidney pointed out, it only passed by one vote in the House. Anything we can do to make it more difficult for them to get all their contending factions together in both the Senate and the House, that's our job. So yes, the measure of success here will not necessarily be reflected in the votes of either of our senators, but we could have an effect that we will not know that we're having simply because of the information they feed back to the rest of the Republican caucus and to the leadership.
I think it's important, just to piggyback on what you said, it's important to know that the staffers are listening. So I have had an opportunity to engage with Senator Blackburn and her staffers. The conversation with her staffers was different from the conversation with Senator Blackburn. And Senator Haggerty's staffers are also listening. And they're the ones that are probably going to see the messages, get the phone calls coming across. So I just wanted to add that. Ann Lucas mentioned that Tennessee has a large population of veterans. And I know that Fort Campbell is in Senator Marsha Blackburn's district. Talk to us about messaging with regards to special interest groups based on the impact. And I'm going to come to you first, Signe, and then go to Gordon.
Yeah, thanks for lifting that up. Just like many others, veterans will lose medical coverage. They will lose SNAP if this bill goes forward. It will significantly raise costs for buying food and groceries and seeing a doctor. And this is on top of the huge staffing cuts that are already have implemented the Department of Veterans Affairs. So that's one thing that I'd lift up. And I know the person in the chat mentioned that there are a lot of veterans in Tennessee. The work requirement piece too, like veterans, for our senior veterans, they would now be looped into that. So that's something to keep in mind. And then I know there was another comment about senior centers and folks being concerned about immigrants receiving benefits. There are so few immigrants that are eligible to receive these benefits. And so that's not even a thing. And we would love to talk to anybody who has that information. Educating is another big and important piece of this process, is making sure that people understand how these programs actually work and who they reach. And sadly, the immigrants who are eligible to participate are even being knocked off of SNAP and these programs because of this bill. So if this bill goes forward, our refugee neighbors and people who are here seeking asylum will no longer be eligible for SNAP. So I think that's something to lift up and let the folks that that you serve know that that's not something that happens. There's such tight regulation around the SNAP program that doesn't allow folks who aren't eligible to receive the benefit. And we are also happy to help educate and come share information for folks who might have the ability to speak to their network of folks about how these programs actually work.
Thank you. So we need to hear from you. We have about 6 minutes left. What do you need to support your advocacy efforts? Are these weekly briefings helpful? Just trying to get an understand if there's anything that we're missing. We do, like Sydney said, we do community presentations both on Medicaid and SNAP. We try to push out information through social media. Our comms team, Reed and Danelle, who are a small but mighty team, and you're not going to see their faces, but we could not do this without them. So social media, the traditional media, making sure you have just-in-time information regarding data and numbers that are coming down from our national partners. I can't tell you how many emails I get on a daily basis. Sort of overwhelmed with information, and then we try to package that information in a way that is digestible for you and other members of the community and residents of Tennessee. So let us know either in the chat or if you have a very succinct ask, if you raise your hand, I'm happy to recognize you. I'm looking in the chat right now. Each week you motivate me to call with another aspect of the bill. And thank you for that. I think we have to motivate each other. You know, here at the Tennessee Justice Center, we had a team of interns that started here yesterday. And these young people are energized about making a difference. And so they're part of this advocacy effort, part of the policy effort. They're working with our clients to make sure that they are able to understand and receive the benefits that they are entitled to. So this is really a team effort and a group effort, and everyone on this call is an extension of the team. I don't see any hands raised right now. Gordon, Sydney, is there anything that you can think about that you would want folks to know?
Thanks, Danae. I'd like to just elevate a couple of comments that our good friend and longtime colleague Claire Sullivan put in the comments, noting that the 400,000 people are likely to lose coverage under the ACA because of the failure to extend the premium tax credits. And those sometimes get left out of the projections by CBO because it has to do with the way they calculate the baseline. But thank you, Claire, for pointing that out. That again is another way in which there's an effort to undermine the ACA without being quite as blunt about it as they were before. Claire also makes a point about sequestration, and I described sequestration before as the executive branch withholding some appropriated funds. That is accurate, but there is a technical automatic sequestration that occurs, and I'm not sure, it has to do with deficit spending, in which at some point there can be a withholding of funds automatically. I'm now deep into my realm of ignorance, but just to note, Claire noted that it could have Medicare consequences. The reason why I raise this is not to advertise my ignorance, but to say that some advocacy experts at the national level have been telling us at the state level to downplay the impact on Medicare because for reasons I don't fully understand having to do with sequestration. If you look at what's really happening to Medicare and Social Security, it could result in some automatic rollbacks of funding. Again, I'm at the outer limits of anything I understand, but all to say, you won't see the Democrats talking much about the impact on Medicare that we've been describing here today because of some of those concerns. But the impact is real in terms of what Medicare beneficiaries will be feeling.
I was typing, but I'm going to answer, John. I'm going to answer your question. The response for staffers is that they want information, data. They want to understand the impact to different groups, populations for the SNAP and Medicaid cuts. And so that is where the stories are critical. And also, I don't know if they're really thinking about the impact to the state budget. And so the stories, the numbers, the financial impact to the state budget, and the number of individuals impacted, that is what the staffers are looking for. They're not necessarily, or at least with my personal experience, I can only speak from my perspective. When I was engaging with them, they weren't lifting up those hard rebuttals compared to when I'm actually having the conversations with our elected officials. I hope that answers your question. We are right at time, and we're going to probably get to your question in the materials that go out. We are right at time. We appreciate you being with us. We will be here next Wednesday, same time, same place. Next week, we also hope to learn a little bit more about your advocacy efforts because we might be able to learn something and adjust our strategy somewhat. But we are all in this together. Thank you for being here. Stay the course. Let's make this happen. Have a good day, everyone.
Thanks, everyone.
Thank you.